We're now recording the session, and I'd like to welcome everybody to Sustaining Continuous Improvement by Unit-Based Teams in Healthcare. I'm your moderator, Joel Cutcher-Gershenfeld. I'm delighted to see that we already have 30 people signed in. Just a few housekeeping details. If you want to pose a question, put it in the chat or use the hand raising feature. We'll ask each of our panelists and our discussants to go first, and there will be time for discussions as we go on. To start with, let me just share my desktop with you, which has on it the session slides. And what I want to emphasize is that this is a unique panel. It includes two people, Katie and Shannon from Labor and Management, who are at the regional level and will be giving us both a frontline and regional system perspective on unit-based teams. Wale, who is a doctoral student at Brandeis, is looking at survey data from Kaiser-Permanente and the coalition the Alliance of Healthcare Unions. And then Jim and Hal are at the enterprise level, stepping back and giving us, if you will, the bigger picture still from Labor and Management. We have Dennis Dabney, who is, of course, not just the Vice President of Labor Relations for Kaiser, but also our LERA President, and Tom Kochan from MIT, who's long studied the KP system, who will be serving as our discussants. To get us started, what I'd like to say first is three things about unit-based teams. The first is that the idea of frontline knowledge driving continuous improvement is something that is longstanding, but really picked up steam after World War II, and in a number of industries and sectors has become the sort of a leading practice on continuous improvement. In healthcare, Kaiser-Permanente and the Alliance of Unions, healthcare unions, were among the first to pioneer the use of unit-based teams. And as you'll hear, there are now thousands of them throughout the system, and they are integral to the way this system operates. And the idea of frontline knowledge driving healthcare is now no longer a question of whether it should happen, but the question of how best to do it. And of course, this panel promises to take us into those principles and those methods. In the discussion, we have time both to go into the implications in healthcare as well as applications in other sectors. You will also hear from the panelists some discussion of COVID and other challenges that are happening in society today. This is not without context. And so the third thing is that we will be talking about both the nuts and bolts of unit-based teams and placing them in context. For each speaker, I'm going to first have them start to speak so that you can get a sense of who it is that's talking. And then for at least 4 of our speakers, we have some slides that they provided that we'll share. So without further ado, we'll start with Katie. And Katie, in about a minute or so into your remarks, I'll bring up the slides. But first, if you would start by just introducing yourself, and giving us a little context so we know who you are, and then we'll get into your presentation.
All right, thanks, Joel. So my name's Katie Ekstrom, and I am currently the Northwest Regional Director for the Alliance of Healthcare Unions. And for the next 5 to 7 minutes, I'm going to give you a little context about, I hope to describe what it's like to be an actual frontline worker at Kaiser-Permanente. But before I do that, I have to throw it back to when I joined healthcare. So I joined healthcare in 2007, and I worked for a private group of surgeons who owned their own surgery center. So there's 3 things you need to know about that experience, which is the only things we talked about were how many patients we could take care of in a day and how much money we could make off of each one of those patients. to give you a feeling of like what it was like to show up to work every day, it was a lot like working on a factory line. No one ever asked my opinion. We never looked at data. We didn't have discussions about how to best take care of the patients. And so when I joined Kaiser in 2010, it was a pretty euphoric experience in a lot of ways. I was so happy to be there. And within 1 month of my employment at Kaiser-Permanente, I found myself in my first unit-based team meeting. And in that first meeting, I had no idea that I would like go on this journey with hundreds of other employees using PI tools, working on a project that was later coined the Pathway to Zero.
And by the way, when you say PI, you mean process improvement.
Process improvement, yeah, sorry. We're really bad at acronyms at Kaiser. So, you know, later after the project had been completed, it was called and talked about all over the Kaiser system. And we referred to it as the Pathway to Zero, which was the desire to have 0 surgical site infections for our patients. And I won't talk about all the details, but it really was hundreds of employees across, you know, a dozen surgical teams that were multidisciplinary, from the pre-op clinic all the way into the PACU. And that all that work touched everything from how patients were taught to bathe before surgery, to the kinds of materials that we bought for head coverings, shoe coverings, the type of antibiotics we gave pre and post surgical cases. And it was all in an endeavor to have our patients have the safest surgical experience possible. So that was the first big project I worked on as a frontline caregiver in the KP system. And then in 2013, Shannon and I actually both worked together, neither of us in the positions that we hold now, but in different positions, helped open the Westside Hospital in 2013. And that was a big endeavor. It was like a life-changing experience. I don't know that I'd ever sign up to do it again because it was a lot of work. But we used the unit-based teams in that hospital, not only to open its doors and start taking care of patients, but the UBT work led to program leading quality and service outcomes within 6 to 9 months of opening the doors. And 6 years later, that hospital is still program leading. So those are just 2 lived experiences of how our program functions. But the other point I wanted to make is that a lot of people don't think of UBTs as a way to create, recruit, find leaders. And when I think about the partnership as a whole and the UBT program, I do think of leadership development. When you become a steward in a regular traditional labor relations type of setting, you become a steward and you get grievance handling 101 and that's it. But if you become a UBT co-lead at in Kaiser, you get trained in advanced skills like interest-based problem solving, consensus decision-making, PDSA, RIM, effective stakeholding, crucial conversations, and those skills give you opportunity to advance your career inside of Kaiser. And so I guess I just want to leave people with a feeling of what it's like to participate for a frontline worker. And then last night, actually, I was trying to think about all the things I wanted to say, and I came across a Bernard quote, which I won't read verbatim, but he used to say that every employee in our system has a place at the table and a voice. And I don't know how I came across that last night. It was just coincidence and good timing, but that couldn't be more true.
Super. Well, thank you so much for really sharing with us your lived experience. And in the process, you really helped to educate us on how integral unit-based teams are to everything from day-to-day operations to designing and launching a new hospital. So thank you. Thank you very much.
Thank you.
Your partner at the regional level is Shannon. Shannon, why don't you begin by introducing yourself, and then as you do so, afterwards I'll put your slides up and you'll take us into sort of unit-based teams in context.
Great, thanks, Joel. So I'm the Performance Improvement Director for the Northwest region, and that is Oregon and Southern Washington. And I partner with Katie. We are constantly in contact to just with the unit-based teams, but all sorts of labor management partnership work that happens in our region. And I'm going to spend a few minutes talking about some performance information, some data from 2019 on our unit-based teams, the type of projects they do. I'll go into a few examples of some of the projects that teams have worked on last year, and it will tie in nicely with what Katie was saying with her experiences in the OR. So the slide that you see here shows our value compass. And this is really has become a symbol of the labor management partnership and our focusing, our guiding star for all the improvement work that the unit-based teams do. So this was designed really, a decade and a half ago, I want to say, as the unit-based teams were first forming. And so you can see that we have the patient and the member at the focus of all the work that we do. So whenever there's a question, are we doing the right thing? Or this is where we hone in and make sure that we keep the patient and member at the focus. And we look to work on our service and our quality, keeping our system most affordable, and then focusing on the best place to work. So that's our employee well-being, employee safety, and our culture. And so these numbers show the number of projects that our unit-based teams worked on throughout the course of 2019. And so if you add them up, it's just under 3,000 projects that our teams did. And we have, in our Northwest region, we have about 420 teams. So that's quite a few projects per team that the region worked on. And if you can go to the next slide, please, Joel. And these projects, the teams select them based on a number of data that we provide that the teams have access to. And as Katie mentioned, I think one of the key sets of information that the UBTs need to be successful is to have that transparency and know what the regional data is, so the teams know, are they working on the right thing? How can they tell the degree to which they're making an improvement? And of course, we want to be able to spread and share best practices. As Katie's example, where they did this great work at the Westside Hospital and then wanted to spread that through other regions in Kaiser, so we can learn from each other and not continuously reinvent the wheel. So each unit-based team has a set of goals. And these goals are set every year in partnership. So that's with labor leaders and management leaders through each business line. And those goals are linked to our annual incentive plan. And so depending on performance, the frontline team members, unit-based team members, will receive an incentive plan payout in the spring. And then those incentive plan goals are also linked to our regional and national operating and strategic plans. So there's a lot of connection through the priority work of Kaiser that cascades down to the unit-based team level. So this slide that's here is just highlighting one of the many, many improvement projects that the teams have done last year. And this particular one, I picked a feature because it shows, this is the emergency department entrance at our Sunnyside Hospital. And our emergency department staff is one unit-based team, and then the patient access representatives. So those are the folks that you would check in or check out of when you're in the emergency department. They're a separate unit-based team. And so those two teams came together to try to figure out how to better capture registration for ED visits. And each missed registration is somewhere around $1,200, $1,400. And so by just making some changes to their workflow, better communication, not having patients slip through the cracks where there was those handoffs, they were able to improve the captured registrations by 37%, which equates to about a $2.1 million annual revenue capture. So, and that's just 2 teams working together. And then in outpatient, there's many examples, such as laboratory specimen turnaround time, team culture and morale. So how do unit-based teams will work on, sometimes it's not the process of patient care, sometimes it's their own, how are the employees interacting with each other, that they need to do some improvements with stress management, morale, employee engagement, they'll take on that. Of course, patient satisfaction. And then through COVID, teams have had a number of workflow disruptions, and it was the equivalent of mini rapid improvement events daily that the teams were tackling and just constantly tweaking and adjusting their workflows to ensure that the patients were taken care of. The teams were keeping their spirits up. They were practicing safe practices, and of course, being able to have as many people cared for as possible given the new restrictions. You can see there's a few other examples here, and I will close with that, and I believe the next speaker will go into some more data around the team performance.
Thank you, Shannon. And I really appreciate your sharing not just over 3,000 improvements by 400 teams, which is going to be impressive to many of the people in the session, but the fact that they map onto the value compass and roll the triangle with the teams at the top, as well as some very specific examples. Much appreciated. And as you say, Wale has some survey data to share with us from this whole system. Wale, the floor is yours.
Thanks, Joel. Hi, everyone. It's so good to be part of this group.
Introduce yourself first.
Yes. So my name is Wale. I'm a PhD candidate at the Hello School at Brandeis University, and I study healthcare workers, healthcare organizations, and broadly structural and relational interventions that impact healthcare workers within healthcare organizations. And so thanks for this opportunity, Joel. For this presentation, I titled Evidence-Based Partnerships in Healthcare. I'll be sharing some preliminary analysis from survey data that was collected sometime last year. I hope to give a brief overview of the survey, highlight key results from the survey, and then conclude by giving a brief summary of what the preliminary findings are from the survey results. So the first slide here is sort of an overview of the survey and the respondent profile. And from the analysis, I found 2 things that I described as opportunities listed at the top there, which is positive views from those not in UBTs, but open to being involved in UBTs, and also positive views by those receiving some type of training and orientation. And one thing I consider a challenge is the views of those not in UBTs and not interested in being involved in UBTs. And I just highlight this to kind of frame what the discussion, what the gist of my presentation would be. Data for this presentation comes from the key stakeholder survey, like I said, was administered in January and February of 2019, and it had a total of a little over 3,000 respondents. And this survey asked questions about stakeholder views on the inputs and impact of labor management partnerships and unit-based teams. This first slide shows a few descriptives of the respondents. So we see membership of labor management partnerships. We see the gender. We also see the roles that were included in this survey. So the next slide. So this is just a continuation of a respondent profile, and these two variables here, UBT participation and labor management partnership orientation and training, are particularly important for this presentation because they are the key variables I use in my preliminary analysis. And for this analysis, I pretty much grouped it into 3 stages. The first is to determine what stakeholder views on the process, on effectiveness of UBTs and partnership. So how do people view it as a process based on their participation or not in UBTs. I also looked at how stakeholders view the impact of UBTs on outcomes such as safety and satisfaction, based on their participation in UBTs or not. And then finally, I look at the impact of training on these views of stakeholders. So I'll just go into the findings. So this particular chart shows how employees view the impact of UBTs and LMPs on effectiveness of UBTs and partnerships. So essentially, how do people view it as a process based on their participation in UBTs or not? And you can see I've highlighted a few data points on the charts just as key points of focus. And the summary finding from here is that UBT participants and those who are interested in participating in UBTs are far more positive on the importance of UBTs and LMPs in improving partnerships and UBT effectiveness than those not interested in participating. And then those not involved and not interested see it as not so difficult to do, as we can see from the data points there. Next, I tried to see what the views of stakeholder on outcomes are. So these charts here just show how employees view the impact of UBTs and LMPs on outcomes such as improving quality of work and improving member and patient satisfaction. Other outcome variables that had consistent results with what I have here include conflict resolution and just quality of work on the units. They had similar findings. But what we found here is that UBT participants and those interested in participating were both more positive on the importance of UBTs and LMPs in improving quality of work and member satisfaction, and generally just improving outcomes than those not interested in participating. And we also found that those not interested see it as difficult to do. So the next slide speaks to LMP orientation and training, and just the difference in perception based on having received some type of orientation and training or not. So this chart shows the impact of labor management partnership orientation and training on how employees view the impact of UBTs and LMPs on partnerships at work, and also the effectiveness of UBTs. And I've also highlighted, the key data points that I want to speak to here. We see the chart showing 3 different groups of people. A first group of people who never received any form of orientation and training. A second group of people who received orientation and training when they were hired, but not in the last year. And a last group of people who received orientation and training within the last year. And what I found was employees who received orientation and training in the last year have the most positive view on the impact of UBTs and LMPs in ensuring effective partnerships and UBTs than those who have not received training the last year or never received training at all.
And by the way, I just might add, the scale for the difficulty, a lower score means it's more difficult. The scale for importance, a higher score means it's more important.
Right. Thanks, Joel. And then for the last chart, this shows the impact of LMP orientation and training on how employees view the impact of UBTs and LMPs on improving quality of work and also improving member and patient satisfaction. The summary of the findings here, like we see highlighted in the red bubbles, is that employees who received orientation and training in the last year again, and those who received at the time of hiring, but not in the last year, were both more positive on the importance of UBTs and LMPs in improving the quality of work and member patient satisfaction than those who have not received training at all. And so the summary finding of this preliminary analysis, two key findings were that one, participants and those interested in participating in UBTs are associated with more positive views. They view the impact of UBT on process and outcomes more positively than those who are not currently participating in UBTs and do not plan to participate in the future. Secondly, that those not involved in UBTs but open to being involved are even more positive about UBTs and LMPs in ensuring effective UBTs, quality of work, and member satisfaction. And then lastly, labor management partnership, the orientation and training within the last year is associated with increased appreciation for the importance of ensuring partnerships, effective UBTs, member and patient satisfaction, and also quality of care on the care units.
Thank you, Wale. And I really appreciate how you've lifted up the fact that there's an opportunity for KP and the Alliance in terms of those not in unit-based teams, but interested in being so, who have very positive views, as well as the importance of doing training, particularly more recently, the more impact you have, but also a concern that there is a substantial number of people who are not involved, it's voluntary, and are not interested, and that represents a challenge in terms of how to engage or whether to engage those folks. Thank you. Now we're going to jump up to the enterprise level and turn to Jim. Jim Pruitt, if you would begin by introducing yourself and tell us a little bit about how to put what we've just been hearing in context.
Thank you, Joel, and thanks everybody for joining our session today. Here's the context I'd like to provide for all of you. This Kaiser-Permanente Alliance Labor Management Partnership goes back approximately 23 years. The work that you're hearing about today began at the latest around 2005. So it goes back about 15 years, or most of the years that this partnership has been in effect. The Alliance unions, this is a report from management. Mr. Ruddick or other union leaders on this call are more than capable of refining any of this, but the Alliance unions are several major unions. I won't get them all, but AFSCME, Teamsters, Unite Here, UFCW, several others. About 50,000 Kaiser-Permanente employees. Average salaries somewhere rounding off in the neighborhood of annualized $120,000. These unit-based teams are fortunately well supported by scholarship. So there's Professor Tom Kochan, who will be talking, Professor Cutcher-Gershenfeld, who has organized this panel, tracing all the way back to Professor McKersey and his path-breaking work. So that unit-based teams are important and they're well-resourced. The amount of resource that goes into paid time off, project management, and the other type of things is negotiated between Mr. Dabney, who's on this call, I'm glad to help, and Mr. Ruddick, who's on this call. So annual budgets are set up. That's all an important set of context. There's maybe 3,500 unit-based teams, and they're doing work in the COVID environment exceptionally. But the only point I want to get across before shifting the other presenters is this point. no matter that we have what I think anyone would agree is an impressive level of support and budgeting in a time that always has scarcity, I'm confident that the concept of frontline work teams jointly making decisions around important healthcare matters in a labor environment is transferable. If you're listening to this call and wondering if in your context it would fit with the minimums of a willingness of unions and managers to work together. Our presentation focuses on some real success. On the other hand, I would not be one, nor would other people on this call, to talk about our system being anything other than imperfect. It's good, but it's not perfect. What you don't hear from us is a presentation like a high school yearbook that this is the greatest and we're the greatest. It's more a presentation of dedicated professionals like Ms. Ekstrom and Ms. Cazinha, who would probably be the best consultants for anybody looking at something like this, as to how it could really work in practice. So thanks for everybody joining, and I'll pass it back to you, Professor Cutcher-Gershenfeld. Joel.
Thank you, Jim. I really appreciate not only the insights into what this works, how this works at a system level, but also the notion that the lessons here are replicable and that you are committed to presenting, an evidence-based full picture, not just a glossy puff piece, so to speak. So thank you. I really appreciate that open and frank approach. Your counterpart at the enterprise level, as well as Dennis's, is Hal. Hal, please introduce yourself, and then I'll get your slides up.
Okay, great. Thank you, Joel, and everyone participating in this panel. My name is Hal Ruddick. I'm the Executive Director of the Alliance of Healthcare Unions, which, as Jim outlined earlier, is a federation of 10 unions across Kaiser-Permanente, representing more than 50,000 employees nationally across Kaiser. And I think as we talk about the context for the unit-based teams, it's important to put them in the context, first of all, of the partnership that Jim alluded to has been in effect for, at this point, 23 years. Unit-based teams were not widespread at the very beginning of the partnership, became a major initiative about 10 years into the partnership and have now become fundamental to how Kaiser-Permanente operates. And one of the things about the partnership or any of the components of the partnership is for it to be sustainable, it obviously has to meet the interests of both parties. And so I wanted to frame up this part of the presentation a little bit by just highlighting why, from a labor perspective, these teams make sense. You heard Shannon talk earlier about some of the savings and operational benefits that management achieved. Katie highlighted some as well. But the teams, for them to be sustained, take a lot of support from both labor and management. But in terms of labor in particular, they take the sponsorship and direct engagement of union leaders, union members at every level of the organization. It was also mentioned earlier about the resources. Those resources are collectively bargained. And the resources that go into supporting the teams potentially could go into other things, whether it's straight into the employee's paycheck or into other benefits. And so there has to be a level of union support and engagement where labor feels that its interests are being met in order to make this sustainable. And I would say one of the things that's been interesting is that as I've been involved in the partnership now for almost 7 years, there's been a lot of sort of ups and downs. Obviously, there's conflict between labor and management. But you always hear the unions wanting to continue the partnership and wanting to continue the teams. And so I think that's an important thing to demonstrate that labor and their members feel that they get value. So this slide highlights a couple of them. Just that people feel empowered. You heard Katie make the distinction between the non-Kaiser workplace that she was at, where basically it was just, okay, how do we get the patients in and out and make money, to the Kaiser context, where employees actually have a say in things that matter to them. Also, I think this is important, is that we do a lot of work to educate people about this, is that if our job as labor fundamentally is to defend and improve the living standards of our union members, we need to have a situation in which Kaiser-Permanente as our employer is successful. It may be self-evident to a lot of people, but I think it's true that in many cases, the structure of labor management relations do not allow the unions to make this kind of contribution to success. I mean, what I mean by that is we contribute to KP's success very explicitly, very directly, and that in turn provides pay and benefit enhancements for our union members. And that's part of how it meets our interests. So it's both having that say on the job and in securing our long-term future. Now, some people, I've been involved in a number of forums talking to people about unit-based teams and performance improvement, and certainly we all know that there is a lot of performance improvement work that goes on in non-union environments or that goes on in unionized environments, but the unions themselves are not included, often at the choice of management, who says, well, we don't really want unions engagement in these work about quality and other things. I think the biggest distinction that I would say between including labor and the top-down approach is that when labor is included, first of all, in a unionized environment, people have a more authentic ability to participate and share their ideas in the performance improvement process because they know that they are protected by having a union contract. Secondly, the labor union is actually able to select their representatives to participate. So those frontline employees who are participating are those who represent the employees. And then the union members themselves gain a level of skill and knowledge and understanding about the business, the purpose of the business, about performance improvement skills, problem solving skills, all of those things. And that skill development among the frontline staff creates a culture of improvement where it is really baked in to the organization. And I think that helps produce very different outcomes than a more sporadic top-down performance improvement that is imposed solely from management. So to conclude on the last slide, I think for people to take away just a couple lessons out of all this. One is it takes a commitment of both parties, and that means it's got to meet the interests of management and of labor. It takes resources and training and orientation. And when you do that, you make that commitment and you invest in it, you build a set of skills that people can then adapt quickly. And obviously, in the last couple of months, we've had a real-time challenge of having to adapt really quickly to something that was brand new for our healthcare environment. And I'll just close, there's 3 examples on here, I'll just close with one, which was a Southern California case where they realized that the pediatric vaccinations were falling behind because people were not bringing in their children to be vaccinated. And people came together and created a drive-through clinic where the patients, the children could be brought in and receive their vaccination. And it was a very complex process to create it from scratch, what the patient flow would be, what the parking flow would be, how you would administer and preserve vaccines in an outdoor environment and all of that. And because those skills have been so baked in to the culture, people were able to jointly come up with this collaborative project in a very short period of time and have it be successful. And that, I think, is the fundamental advantage you get by including labor and management in this process. So that pretty much, I could go on, but I think that uses the time. Look forward to questions later.
Thanks, Hal. I really appreciate not only highlighting the value add to the enterprise, but the value add from the union's point of view of being a full partner in sustaining unit-based teams, and pointing out that once this team-based system is in place, you were able to then leverage those established problem-solving skills in the middle of a crisis. So thank you. We now turn to our two discussants, and needless to say, we've served up a lot about unit-based teams. I'm delighted, by the way, to report that we have 48 people signed in. We're already seeing some questions in the chat, so we'll get to those in a minute. But let's start with Dennis. Your observations and comments.
So thank you, Joe. My intro, Dennis Dabney. I'm Senior Vice President of National Labor Relations and the Office of Labor Management Partnership at Kaiser-Permanente, and also currently for another 2 days, President of LERA. But I'll always be involved. So the one thing I was going to say is there's definitely conversation going on in the chat room. So I invite the speakers to look at the comments in the chat room. Some of those questions are directed to you, and you may be able to answer them in the chat room. And then secondly, I would say that, in my opinion, unit-based teams is a part of an overall system. And to really understand that system, you should tune in to the presidential address later today, where there will be conversation about that you would want to hear. So that's my plug for tune in later. And so as the speakers were talking today, I kind of jotted down some notes. So I'm just gonna go through those, and it's just things that I pulled out of what I heard from each speaker. So starting with Kate, what I heard was, and I agree with, that teams need resources and training. They need training in continuous improvement processes. They need training in problem solving and a whole host of other tools. And in order to assist the business in problem solving, employees have to understand how to do that, and to understand how to do that, of course, you've got to train them. So once you have these engaged employees, those teams can then reach their full potential. Is kind of what I heard Kate talking about. And then I think Shannon kind of reinforced that by saying that a lot of times when you hear about teams, you think teams are working on water fountains and creature comforts and those kind of things. And what I heard Shannon say was that, you know, our teams work on real operational problems that they get from either our strategic plans or from their regional goals and objectives. And then she kind of followed that up with, and here's the results of the work that teams are doing in her region. And I think she gave some real examples. She also discussed some of the things that we measure and work on in the chat room. So if you look in the chat room, you'll see some comments in there from Shannon about other things that our teams work on. And then Wale, so I like his theme, because his theme was evidence-based partnership. And in healthcare, we always talk about evidence-based medicine. So it struck me as interesting that he titled this evidence-based partnership. And he went through that data and basically proved and showed that you can manage through data in a partnership. So as he said, you know, data speaks for itself. And what he really emphasized was those in the UBT that are trained and involved end up with better results in quality and patient satisfaction. And so that's what I heard there. And then Jim talked about the importance of supporting teams and giving them the budget and the resources, again, to be teams. And I think most importantly, and his point as he stated it, was that these concepts are transferable to other industries, other companies, other businesses. And what we do in the Office of Labor Management Partnership is try to promote these concepts to other employers and help them to utilize it. So I think in a separate email, Bob was asking me, can our training material and resources be used? And I said that we really enjoy when people are asking us to use our materials or inviting us to come and speak about unit-based teams, partnership, and those kinds of concepts. And then, you know, I say, Hal always hits the home run, and he talks about, you know, teams are really working on business problems, making the business successful. And then the plus for labor, for the business, for our employees, is you end up with a successful business. If you have a successful business, guess what? You got good paying jobs with good benefits. And I certainly agree with that. And then, you know, UBTs, I think Hal's overall point is UBTs are a better approach to performance improvement for all the reasons that he stated, and they were numerous. So those are my comments as a discussant, and I will turn it over to my buddy, MIT, Tom Kochan.
Well, thank you very much, Dennis, for those comments, and to the full panel. This has been a really rich discussion from the front lines to the leadership. And let me try to put this in a little historical perspective, because as Joel mentioned and others, Jim mentioned, Adrian Eaton, Bob McCursey, Paul Adler, and I have studied the partnership for years and have continued now to look at how it's evolved. And the big question is, why has it been sustainable for 23 years when so many other partnerships come and go? And I think there's a very fundamental answer to that. And that is that you have this grounded in these UBTs at the workplace that have demonstrated their value to so many people across the Kaiser system. And I'll just go through some of those and illustrate why I think this survives through various crises. You've had your ups and downs, and you've had crises where you've had to really recommit to the partnership from time to time. And you've always come out a little bit stronger than you were before those crises posed a challenge. Here's why. The evidence that was presented, both by Wale in terms of support of the rank and file for these teams, mirrors some data that Adrian led the analysis of a number of years ago. It basically shows that the same result, that people are very positive about the partnership. It increases their job satisfaction, and it increases, much as Hal indicated, their support and their satisfaction with their union. And so here you have workers right at the grassroots level saying, this is important to me as a worker, it's important to me as a union member, I see the value added from both perspectives. Second thing that you only see, I think, if you actually observe UBTs in action, and the whole arrangements, the whole range of participatory arrangements in the partnership, the labor management partnership. And we've had an opportunity to do that. The first thing you see when you observe either a UBT or a large team of people coming together around national bargaining to prepare and discuss what their proposals might be is the enormous diversity. It's a mosaic of our society coming together, Black, white, Latina, and men and women, gay and straights, and all the full mix of our society is reflected in those rooms. And the respect that people show and their ability to confront each other with different points of view in respectful ways and based on some training in effective ways is really a beautiful thing to watch. And sometimes it gets a little heated, but there are always people in those rooms who know how to bring it back into focus. And that too helps people to confront reality, to deal with real problems, and to make progress. And the ones who I think have been brought on board by the UBTs more than anyone else are the physicians. Now, physicians are not by nature the most participatory people. They are educated to make very, very difficult, quick, and tough decisions. And so often it's a very individualistic profession. But I've seen physicians who were critical of the LMP become converts once they get involved in really working on these problems. And that means that this LMP is sustainable through changes in leadership, as it has through the various Permanente leaders and the regional leaders and the national leaders on Kaiser's side of the organization. That broad-based involvement and firsthand experience is what I think has helped to really sustain this process over time. Now, the last thing I want to say is a bit about where does this fit into the future of work and the future of labor management relations. Well, if there was ever a point where we need labor and management to come together, workers at all levels to demonstrate that they've got value to add and the ability to speak with respect and to speak independently and not fear retaliation and to stand up for safety and to stand up for all of the equity issues that we are facing. Now is that time. And so here's an organizational model that allows people to express their voice, to bring it to bear, as the example that Hal mentioned, and he could have mentioned several others on his slide. When the crisis came, they could find ways to put those skills to work to address a unique problem in real time and get on with it. That's what we need in our society, and that's why many of us see the Kaiser-Permanente with all its contributions and all of its warts, which any institution has, as a model for labor management relations in this country going forward. And let's hope that we can have an opportunity to bring this model to more and more parts of the workforce and more parts of labor management relations in the years ahead. So I appreciate what you're doing. Sometimes I'm critical of what you're doing because that's our job as researchers. We're not there to just tell you the good news. We're there to do what we can to help you move forward. And sometimes that requires challenging some current practices. So that's the beauty. And we are fortunate to be able to continue to work with you and to continue to study what you are doing and hopefully contribute to continued success. Thank you.
Thank you, Tom. Well, we have just 8 minutes left, and there are a series of questions posed in the chat. What I'm going to do is follow the order of the panel with the questions, but it gives you basically 1 minute both to respond to the question and offer a final word or thought now that we've heard from everybody. So I'm going to give you the quick overview for everybody, and then we'll dive in. Shannon, you've already responded online to a question about what would be an example of a UBT goal, but if you want to say anything else about the UBTs and goal setting, you have license to do that or make any other concluding comment. We'll come back to you in a minute. There's a question about what kind of outdoors training or other kinds of experiential learning takes place. Katie, you can answer that. There's already been some answers online, but feel free to talk more broadly about the whole idea of training and interactive learning as a piece of this. Wale, there isn't a specific question to you, but you get a final word just in terms of your impression diving in on the KP data. For Jim, there's a question about the doctors and the nurses, especially the CNA. How do they interact with these teams? Hal, there's a question for you about how does this fit with the overall role of union members and stewards in terms of grievance handling, day-to-day operations, and LMP committees? Then Dennis, you and Tom, there's a final question about technology, employee records, and other kinds of technological improvements, and how does that relate to UBTs? And from Adrian Eaton, we also have a question about the relationship between top-down goal setting and bottom-up employee-led improvement efforts. So those are the questions that are on tap. I'm just going to follow the order of the panel in which you have the question in mind, but you also get a final word. Let's start with you, Shannon.
Okay, thanks, Joel. So around the goals, I gave a number of examples around the type of goals UBTs have. Our unit-based teams span across the enterprise where there's patient care, so figure the hospital and ambulatory care settings, but it's also the supply warehouse, it's financial services, so billing and claims, it's the call center. So a lot of these areas have very straightforward goals, and then others are tricky on how to figure out what's meaningful. And what it comes down to with the teams is, how do they know they're doing good work? How do they know that they're what they're doing is effective? How do they measure success? And we have several data analysts that help with this. And we meet with leaders, labor and management leaders from each business line, and do a deep dive into what data would be meaningful on a team-by-team basis. So for our region, we have about 425 UBTs. Other regions have thousands plus. Now, a lot of the teams, so for example, like primary care, if you're in internal medicine, family medicine, pediatrics, that's pretty consistent goal setting across various medical centers. But then there's these like one-off teams, or there may be only one or two, or a small handful, and the data, the metrics aren't as prevalent, or they're tricky. UBT data or measures should be for the team, not individual based, and we'll work with them to drill down and find ways to measure the work of the team so that they have goals that are meaningful for them.
Super, thank you. That feedback loop is so important in any system, and making it real for teams. I really appreciate the care with which you do that. Katie, the question is about team building and outdoor stuff, but really you have license to talk about training more broadly. I know you work deeply to get the training right.
Yeah, I guess I don't have any prepared examples, although UBTs, depending on the size and the type of employees, do have projects like, we're gonna meet on Saturday and go for a hike, or we're gonna go bowling. They do different team building events. Whether those translate into true projects,
But you can go say more broadly about just training in general.
Yeah, so, we have a huge variety of training for unit-based team co-leads, but also just for members. So anything from process improvements, tools, to what I talked to about earlier, which is maybe you don't want to be a co-lead, but you do want to be a steward, and you want to advance your understanding of what it means to stakehold for your constituents. You want to learn how to have, critical or crucial conversations with management, or maybe tough members that you work with. So there are a whole host of ways to broaden your skill set at Kaiser-Permanente. I worked at Kaiser for 10 years, and I can say that Kaiser invested a lot of money in me. So I hope they're not too mad that I went to work for the Alliance. It is, as always, and in life, it is what you make it. Nobody is gonna tell you how to advance your skill set. Nobody's gonna hold your hand. You have to dig in and find the resources and be committed to self-improvement. But if you want someone to invest in you, Kaiser's a good employer to have, because if you are creative and capable of solving tough problems, you have a role to play. And people who know me, and there's a few people on this call who do, know that I always have a lot to say about any given problem, and I can never keep myself out of it. It's a real issue I struggle with. I'm involved in everything all the time. But that's why the time that I spent at Kaiser was so enjoyable, and it's the reason that I had the opportunity to go work for an organization like the Alliance. So.
Super, thank you. By the way, for the folks on, we're probably going to go a few minutes over, but let's keep our last comments brief. Wale, you have 30 seconds just to give one kind of nugget that comes out of your impressions looking at all of these data.
Yeah, so I would just follow up on Katie's point about training and the importance of training. And just because I think the data that I see here validates investment in training. So just the idea that training and retraining is highly associated with an increased appreciation for the importance of ensuring partnerships and effective UBT's members' patient satisfaction, as well as quality of care, speaks to I guess the value of investing in training. And one last thing is also the fact that individuals who are not involved in UBTs but have intentions to get involved in UBTs actually have more positive views than individuals involved in UBTs currently. And I think this is an indication, or it's just a good thing to note for supervisors and managers of UBTs to make sure that when these individuals eventually get involved, their expectations are, I guess, not cut short. Yeah.
Super. Thank you for sharing. Jim, question about the doctors and nurses as well as your final word.
Sure, thank you. Here's the answer and my final word all wrapped up in 30 seconds. Physicians, I'll add to Professor Kochan's remarks and add this comment, are involved in at least a third of the unit-based teams. They properly see it as a method of employee engagement that's ideal in the Kaiser-Permanente system. As to CNA is a powerful and well-resourced union itself. Though choosing not to be in the partnership, there are many informal contacts between the unit-based teams and registered nurses that we value highly. It's also important to point out that within the Alliance of Unions, there's an independent union in our Hawaii region, there's AFSCME, there's American Federation of Teachers, and there's UFCW that represent collectively thousands and thousands of registered nurses who are committed to the unit-based team. I'd invite Professor Paul Clark of Penn State, who's an expert in nurse unions, to study that phenomenon sometime, Professor. I'd tell Katie Ekstrom, we're not angry that you left Kaiser-Permanente, went to the Alliance, quite the opposite. And I want everybody to know that I'm honored that Professor McKersey is on the call, and urge everyone to read his path-breaking work on collective bargaining. Thank you, Professor, for being on the call. Back to you, Professor Cutcher-Gershenfeld. Thank you.
Thank you very much, Jim. How people are interested in putting this in the larger context of grievance handling and collective bargaining?
Yeah, that's a really good question. And there's not a simple answer to it because there are a wide range of unions in the partnership, and each of those unions to some degree has their own culture as to how they want to handle bargaining and how they want to handle grievances. So there's not one consistent answer that I could say. A couple observations though. The national bargaining that we do is in an interest-based form. And because of the partnership, touches on a wide range of issues that are outside of mandatory subjects of bargaining as traditionally encompassed. So lots of discussion about quality and teams and partnership and how we work together that would probably, I know, would not be in a traditional collective bargaining environment. So there's a broader labor management engagement on a lot of topics. In terms of how the problem solving on the more traditional issues gets addressed, I would say that because of the relationships that are built by jointly working together on the operational procedures, whether people formally use interest-based alternative methods, sometimes we do, sometimes we don't, there is a higher level of communication and engagement and relationships that are created through the partnership that do promote the solving of problems in a different way than in a purely traditional or adversarial relationship. So I would leave it at that, and that could be
Nice.
a whole nother panel.
Thanks. last two questions, but also the last two comments from Dennis and Tom. One is about there's bottom-up process improvement, top-down goal setting. In my own work, we look at middle across horizontal alignment as a third dimension. And as well, technology. Dennis and Tom, you each get a final word.
I'm going to talk about the technology real quick because we have the Office of Labor Management Partnership paid for people that we call Workplace of the Future coordinators in each region. And each region has established a Work of the Future committee that works on, well, what is all that new stuff that's coming into the field of healthcare? How do we engage labor and others around how to bring that into our environment? And we have also asked Tom Kochan to help us with a study on when we've brought in new technology, what are some of the benefits of that technology that we can capitalize on? And more importantly, what do they see as they talk to folks across the regions about technology and how we can capitalize on it? With that, I would thank everyone. And again, I would emphasize in about 10, 15 minutes is going to be a real good session. You should all attend. Thank you.
Well, Dennis, let me just reinforce your last comment. I can't wait to hear Dennis's remarks. This will be the culmination of his presidency, which has been such a path-breaking year for all kinds of reasons, some by necessity, but all by the strong leadership. So we'll look forward to your presentation. But let me just build a bit, final word on the technology. As Dennis mentioned, Joel and Barbara Dyer and Nubab Aurora and I are in the middle of a study looking at how the Workforce of the Future committees engage with their innovation centers at Kaiser and really apply the lessons of the partnership to bringing new technology in to transform care. We have an intensive case study going on in Southern California in their outpatient clinics that are very innovative, and they're building a transformative model of care. And it's only because you can build on this foundation and you have people who are looking to the future and asking, how do we need to adapt on a labor management partnership level, and some very, very dedicated people at all levels of the organization. So this is the next frontier. We've got to use technology effectively, and I think we're learning from Kaiser, just as we learned from the UBTs, that this is one of the real values of partnership in action. So great session, everyone. Thanks, Joel, for putting it together.
Well, please join me in a virtual round of applause for really an extraordinary session from the front lines to the enterprise UBTs in context. Thank you so much. And as Dennis says, we're all looking forward to your presidential address. So we're going to dial off here. I'm going to stop the recording, and I'll see you all very soon.